Practice in Toronto. He's been an avid student of health, diet, and lifestyle principles since his teenage years and has been teaching health classes and seminars. Dr. Tony Van Hoof's mission is to change and save as many lives as possible. And today we're going to talk to him about herniated discs and back pain. Thank you, Dr. Van Hoof, for being with us.
Thanks for having me.
It's a pleasure. Okay, so what is a herniated disc? I know it's painful. I've heard about it. How do you get it, and how do you fix it?
Well, as Joanne said yesterday, Zelda, 80% of people experience low back pain at some point in their life. However, even if you don't feel pain, we're not always clear. They say about 20% of asymptomatic patients actually have disc herniations on an MRI. So, when you get pain from a disc, it's because it's normally pinching on something like a nerve or is inflamed. Now, most disc herniations rarely are caused because of serious trauma. More commonly, they result from smaller, repetitive stresses over time, like lifting, bending, and more commonly than ever now, sitting for long periods of time.
Okay, so, there was a time when people would do nothing about this. They would find out that there's really nothing they could do and they'd have to bear the pain.
Yeah.
What can be done now to alleviate this incredible pain?
Well, that's a great question. I think most people don't think it's a big issue because their back pains will come and go, but most of these injuries happen because something gets damaged, most commonly a ligament or a muscle that supports the spine. So we may have an injury that's sustained because of a trauma, or, again, when we're sitting, the spine starts to shift around, causes undue stress on the disc, which causes it to degenerate. And this happens over time. So often we will ignore those little signs, take a pill, get a massage, go for an adjustment, or do something short-term to alleviate that. But the biggest problem is as that spine continues to degenerate, it starts to close in and pinch those nerves more regularly. Those same nerves that go off and supply everything in your body. In your low back, for instance, your bowel, your bladder, your reproductive organs, the sensation, muscle strength, reflexes in your legs, all supplied by those nerves. And your spine and discs are the only thing that protect it. So the only way to know whether or not your spine is in the right alignment, whether or not your discs are damaged, is to get properly assessed. X-rays are very important to tell us if the spine has been compromised or the discs, and also get your muscular system checked out, like someone like Joanne James at Medfit, where they set up personalized programs to allow the muscles to help stabilize that spine as well.
Okay, so how are you connected to Medfit? And if someone has a problem, would they end up seeing you as well?
Well, with Joanne James, I've worked with Joanne for many years. We're both very passionate about helping people with their health. I personally am involved with her. However, their programs are designed to direct people to the right places. So they'll customize your needs through their assessments, whether it be to me or another chiropractor. It may be give them the opportunity to get their checks up, get a checkup, get x-rays taken, and then together work on a program that'll give people the best chance at not only recovering from their current injury, but hopefully in many people prevent it from ever getting too bad.
Tony, why is there so much controversy around chiropractors? I mean, there are some of the most incredible chiropractors, and I'm sure you're one of them, and there are others that don't make the right adjustment. How do you make the right choice?
Well, in my opinion, it's all about education. Chiropractic's been around for 119 years, and most people would never understand why they would go to a chiropractor in the first place. The way in which I try to explain it is, our nervous system controls everything. So, from your heart beating to your lungs breathing to a simple cut on your hand, healing, that's all a natural process from your nervous system. And our spine is the only thing that protects it. So why would someone go to a chiropractor? It's not for back pain alone or for headaches. We can often take pills or do something short-term to alleviate that. But to truly take care of your health, you have to take care of your nervous system, and we specialize in taking care of that. So if you've never had your spine checked by a chiropractor, I'd certainly recommend going there. And, if you have x-rays taken and a clear explanation and understanding of the process, then you can't be disappointed with the results. Too many people are waiting to see whether or not they're going to respond in one adjustment or two. In fact, some people may even feel sore initially and feel that it's the wrong thing for them. It is something that needs to be understood at a deeper level to get the best results.
And do you recommend Medfit for this kind of problem? Do you think that they do their utmost to get people the right people like yourself and give them the right exercise that will alleviate the problem.
Absolutely. Having known Joanne for years, she's a specialist at this stuff. She really is going to look at people's specific condition and requirements and build a personalized program for them that'll complement it. So, for me, it's always about structure and function and strength. So you want to make sure your structure's good, your alignment's good, and then you want to build up all the supportive muscles to support it, because the ligaments themselves that hold our spine together, as well as an ankle that's been sprained, will never be as strong. So we really need to maintain good core stability and strength throughout our body to help maintain that.
I really appreciate the time that you've spent with us, and Dr. Tony Van Hoof is part of Medfit, so if you have a problem, you're going to see the very best, and he is one of the very best at Medfit Rehab. Thank you, Dr. Van Hoof. Thank you so much.
Have
Bye.
a super day. Thank you.
You
Bye-bye.
too. Joanne James, founder and medical exercise specialist of Medfit Rehab, will improve your overall health through medical exercise. Contact Joanne James, 647-259-5481, Columbus Center Athletic Department, Dufferin and Lawrence, medfitrehab.com.